Hi, honey. How was your day?
Not good.
Oh, what happened? Did you have trouble with some patients?
Not exactly. The problem is trying to balance patient care with all the paperwork, rules, regulations. I'm gonna lie down for an hour. I haven't been sleeping well lately. I've been having so many strange dreams.
You don't look happy. What's been troubling you?
I keep having these strange dreams.
Tell me about him.
And the one I remember most, the doorbell rings. I open the door, and several physicians are standing there. They tell me that they've come to my house to take a vacation from documentation. Then they barge in with their suitcases. That's all I remember. What could this mean?
Have you been thinking of retiring and opening a bed and breakfast on Orcas Island again? Has there been issues with staffing?
Well, staffing is always an issue, but our staff is wonderful. However, I have been worrying about how documentation impacts both our reimbursement and our quality of care. Could that be what's troubling me?
It's possible. Maybe I can help you by summarizing the important points regarding documentation.
I could use a clear and concise summary.
Many government audits and reviews involve the lack of documentation. Improving documentation can be challenging when clinicians feel that documentation takes time away from patient care.
Yes, that's the main problem. What areas should we focus on?
Well, orders and certifications probably create the most issues. Having an order or certification is the sound evidence that the service is necessary. Sometimes orders and certifications are signature stamped instead of signed, not signed, or just plain missing. In some cases, it's okay for orders and certifications to be entered late. In the case of observation and short stay services, often the problem is orders that are not detailed enough.
Those are good points. Now, what about improving documentation of the patient's condition?
Often clinicians don't realize that someone reading the medical record months later might be looking for the rationale behind ordering that admission or test or procedure. It's probably important for clinicians to understand that even if they don't have a diagnosis yet, that their current thinking is very relevant and they should put it in the record.
We sometimes have issues with items and services not being properly recorded. What can we do about that?
Show the clinical staff how accounting for units, time, procedures, services, and supplies impacts reimbursement negatively. Not recording time for infusions and observation and units for drugs also can result in incorrect billing. And finally, try to identify the areas where improved reporting could have the greatest impact, and then focus your education and process improvement on those areas.
This was very helpful, but I hope I can remember it all.
I know, it's a lot to remember, but sometimes the only thing you have to remember is to ask a question.
Thanks. I'll remember that.
Okay, an audit found that clinicians are not signing orders. What should we do?
I think we should focus first on outpatient diagnostic services because those generate a lot of volume. And then let's look at the processes in place to get and retain orders. For example, making it easier to get the order.
Okay, but what I'm still concerned about is the clinicians already think the coders are too focused on money and not on patient care.
That's always a problem. Let's try to meet with the parties and hash out their concerns. I suspect there are things that both could do to make each other's jobs easier.
Okay, I'll have the meeting set up.
Also, there might be things that coders and billers can tell us that clinicians are writing that are not necessary, and that could save the clinician some time.
Other than not having enough time, why do you think the clinicians don't write more in the record?
Well, maybe they think documenting their working diagnoses and reasoning is bad from a malpractice perspective. Maybe they don't realize that poor documentation itself is a red flag for malpractice attorneys.
Well, speaking of malpractice attorneys, one of my old college buddies is now a malpractice attorney. Maybe I could give him a call and maybe he could come talk to some of our clinicians.
That sounds like a good idea. Do you want to set that up?
Yeah, sure.
Great. Now, what about the problem of documenting items and services provided to patients? We're losing money because of this.
Let's think about a campaign that involves clinicians in improving documentation for better reimbursement and quality. We could offer CMEs, and for employees, we could even think about reimbursing them for their efforts. Then we could use the savings to purchase equipment that the clinicians need.
How about offering rewards and prizes, like short vacations?
Well, you know there are strict dollar limits on physician gifts. And I'm afraid we'd only be able to send them somewhere local.
Oh, hi, honey. How was your day? Oh,
Wonderful. It was just like a dream.